All right, anatomy students, welcome back to our last lecture over muscles. After you get through this week, you will either absolutely love muscles or you will absolutely hate them. Hang in there, you're almost there. You can celebrate at the end of next week when you take the test over muscles of the head, neck, and trunk. So hang in there. So let's start with our necks. Now, our first muscle here is levator scapulae. You probably can figure out what it's doing. Our origin here is our C1 through C4, coming off of those transverse processes. They're going to insert to the upper vertebral border of our scapula, and they're going to elevate our scapula, but also abduct and rotate our neck. Next is our scalenes. There are individual muscle names that make up this group of muscles. You only need to know them as the scalenes. What do? They flex, rotate our neck, but they can also elevate ribs 1 and 2, and so you can see them inserting down here on these first 2 ribs. Sternocleidomastoid. That's such a cool name for a muscle. Sternocleido, sternum and clavicle, and mastoid. Remember our mastoid process on that temporal bone. So we're going to originate down here on our sternum and our clavicle, and we're going to insert on the mastoid process. This is going to abduct, rotate, and flex our head. Sternohyoid. So again, we're going to think about our sternum, and this muscle is going to act on our hyoid. So if we contract this muscle, that is going to depress our hyoid. Remember, our hyoid bone does not have a bony attachment, and it's used for swallowing and speaking. Our sternothyroid here is in green, and that's coming from our sternum to our thyroid cartilage. And again, that is going to depress our thyroid cartilage. Our omohyoid, we can see is this blue muscle attached to our hyoid coming down here, and we have an inferior and a superior belly. You don't need to worry about that, but this is depressing our hyoid. Then we have our mylohyoid, and this is going to elevate our hyoid bone here, and it also helps to elevate our tongue. Now, moving into the head, this is where it gets a little bit more complex. And what you'll see is with the muscles of our head, there are less bony attachments, and these muscles will insert onto fascia or skin. And this is what's going to make lots of funny faces. So I really recommend that you and a study buddy or you and a mirror get together, and as you're working through these muscles to practice the actions, you'll be making all kinds of really funny faces at each other, and that might actually help you remember what muscles are doing what when you're working through this. Our first muscle here is our frontalis. It originates at the gallia aponeurotica. So aponeurotica is an aponeurosis, and that you can see is back here, this large, broad tendon that is sort of covering our skull. It inserts to the skin superior to the orbit, and this is going to raise our eyebrows, but it can also draw our scalp posteriorly. Occipitalis is back here posteriorly by our occipital bone, and this is going to draw our scalp posteriorly. Here's that review and reinforce slide again. Pause your video, practice. I'll see you back here in a few minutes. Hey everybody, welcome back. Let's look at some muscles of mastication. Remember, this is chewing. So our first muscle here is the temporalis muscle. We see that its origin is the temporal fossa here, and it inserts to that coronoid process and the ramus of our mandible. It's actually going deep to our zygomatic arch, which has been removed in this image so you can see that temporalis muscle. Its action then is to help close our mandible. Our masseter muscle then originates from that zygomatic arch, and inserts on the angle and the ramus of our mandible, and this again is also going to close our mandible. Our lateral and medial pterygoid muscles, if you remember the sphenoid bone, we had our lateral and medial pterygoids, those bony projections. Both are responsible for medial gliding of that mandible. Moving on to some muscles of our face. First, we have orbicularis oculi. This is a sphincter muscle, a circular muscle that surrounds our eyes. The origin of the orbicularis oculi is the frontal and maxilla on the medial margin of our orbit, and it inserts to the skin of the eyelid, and so this is responsible for closing our eyelids. The orbicularis oris is also a sphincter muscle, a circular muscle, and it originates on the fascia of our facial muscles. So again, non-bony attachments here. It inserts the skin of our lips, and this is going to close our lips. Corrugator supercilii is this small little muscle up here. This muscle is going to adduct our eyebrows, so bringing our eyebrows medially here. Risorius, here in green, is a little muscle that's going to abduct the corners of our mouth. Mentalis, if you remember the mental protuberance, this is going to protrude our lower lip. So when you're sad and you stick your lower lip out, this is the muscle that you are contracting. Buccinator, again, another cool name, the buccinator, is going to help compress our cheek, and this is involved with our suckling when we're infants. Then we have zygomaticus minor, which we can see here in green. This is going to help elevate the corners of our mouth. And we see zygomaticus major, a little bit bigger, and this is also going to elevate the corners of our mouths. Then we have depressor labii inferioris. We said the mentalis is going to protrude our lower lip. Well, this is going to depress our lower lip, so it's going to move it inferiorly. And then we have our levator labii superioris. So this is going to elevate our upper lip, and it's also going to help flare our nostrils. So take a few moments, practice those muscles. See you in a few. Let's move inferiorly to our abdomen. We have 4 pairs of these muscles that are sheet-like. When we look at these, we can see we have our external abdominal obliques. We have our internal abdominal obliques deep to that, and our transversus abdominis deep to that. So this is anterior, this is posterior, this is where our organs and viscera would be. And then we have our rectus abdominis right in here. Our first muscle, we'll start with our obliques. So our external abdominal oblique, this is the most superficial of those 3, is going to compress our abdominal wall and laterally rotate our trunk. The other thing to note is the direction of these fibers come down, and on both sides they kind of make a V all the way down this linea alba. If we compare that to the internal abdominal oblique, the next muscle deep to that external abdominal oblique, we can see that the muscle fibers up here on the superior aspect of our abdomen make an upside down V, or the top of an A. These muscles also compress the abdominal trunk and help with lateral rotation of the trunk. And then our transversus abdominis, the muscle fibers are running along this horizontal plane. These are doing the same action, compression and laterally rotating the trunk. Our rectus abdominis, this is what people are referencing when we talk about six-pack abs. The origin is the crest of the pubis and the pubic symphysis. And the insertion is up here at the cartilage of ribs 5 through 7 and our xiphoid process, helping us do sit-ups, so flexing our vertebral column, but also compressing the abdominal wall. Now our muscles of the thorax, our first one is our serratus anterior, They originate on ribs 1 through 8, and they're going to insert to our vertebral border and the inferior angle of the scapula, and this helps abduct the scapula. Then we have the internal and the external intercostals. The internal intercostals are making that upside down V, or top of an A here, and they are going to depress the ribs. The external intercostals are antagonists. They are elevating the ribs, and you can see the muscle fibers. If you were to draw these lines out, they would make a V. Okay, so that's one way to help differentiate between these. And then our major muscle of respiration is the diaphragm. So this is a muscular dome. So basically what we're looking at is an inferior view of our diaphragm. So we can see our xiphoid process here, our costal cartilage here, right on the lateral edges here. We can see our ribs, and then our spine right here. This is this dome between our thoracic and our abdominal cavities. We can see our inferior vena cava, our abdominal aorta, and then our esophagus right here. The muscle fascicles are going to extend to this central canal. So our origin is lateral all the way around here, and the insertion is the central tendon. So when we contract, this dome flattens out, and what that's going to do is increase the volume of the thorax. When you increase the volume, you're decreasing the pressure, and that's going to draw air into your lungs. When you relax that muscle, it returns to its normal position, which is a dome, and it's going to decrease that volume of the thorax, and that's going to increase pressure and force air out. Looking a little bit closer here, we can see the origin is here at the xiphoid process along our lower ribs, and then back to our lumbar vertebrae. Our insertion is this central tendon here, and when we contract and relax, its actions are inspiration and expiration. Go ahead and practice for a few minutes, and we'll finish up with muscles of the back. Welcome back. Let's go over the back. First, we have erector spinae. Again, a group of muscles, but you only need to know them as the erector spinae muscles, not individual muscles. The erector spinae are going to extend and rotate the vertebral column and the head. Multifidus is going to extend and rotate our vertebral column. And our rhomboideus major and rhomboideus minor. On the left, we see our rhomboideus major. The origin is the spines of T2 to T5, and it's going to insert on that vertebral border of our scapula. This is going to adduct our scapula. And then rhomboideus minor, again, is going to adduct those scapula back here. All right, ladies and gents, that is it for this lecture. So good luck on your upcoming muscle tests, and we will see you when we go over the brain and cranial nerves.